my presentation. Thanks for being here in the second day, first day, Friday morning. I'm just telling what's a miserable life. Friday morning, 8:30 in the morning. So shaping the policy of atrial fibrillation care in Saudi Arabia. So I have nothing to disclose about this talk. Let's talk about some key facts about atrial fibrillation. We know that atrial fibrillation has a significant, often silent global health with a lot of economic burdens. So atrial fibrillation, now when I keep reading it, it's about the disease, I call it disease of 30s. We have increase of incidence of this disease by 30% globally. There is around 37 million people living individual now with this disease. And that could be doubled in the next 3 days. So we are not talking about a simple disease. And the problem with the disease, that third of the patient can be asymptomatic. 30% would they have no symptoms and then can present with undetected, and sometimes they get with the lethal consequences, as you know. And if you think that we do not have a lot of atrial fibrillation, if you go to the neurology ward, you get a lot of stroke patients, at least 25% they have atrial fibrillation. So, and you know that the prevalence of atrial fibrillation disease is increasing, not globally. We are not any different from any part of the world. That is even increasing in our region. We have a lot of economic development, a lot of Western diet. Now you order the food by your app that will have the risk of diabetes, hypertension, and atrial fibrillation come as a dessert with those. We can see a lot of earlier onset of atrial fibrillation. Yesterday, if you saw the 3 cases that we present, live in a box and the live cases, they were young. My patient was at 28. Fahad presented the cases of in the 50s. Yahya presented a case in the 50s. So they are young individuals. The economic burdens associated with atrial fibrillation estimated around 31 billion in US. This is in 2015, and that could be presented to be doubled in 2045. Same thing in UK. The expenditure for the atrial fibrillation management between 0.9 to 1.6 from annual expenditure. This is 2020, and that will be a 4% fall increase into the next 2 decades. So if you look at the atrial fibrillation story, so atrial fibrillation is not a disease by chance. It has a pre-setup. So it did not start with no pre-setup of a disease. And then if you want to look how to tackle the disease, which stage you're going to look at the atrial fibrillation. We should go with the patient at risk. And if you look at the patient at risk, I think we are sharing the same risk factor for coronary artery disease. So if you tackle diabetes, you tackle hypertension, you reduce the risk of obesity, less smoking. So you reduce the diabetes, you reduce hypertension, you reduce coronary artery disease, and you reduce atrial fibrillation. Maybe this is the best way to go and tackle the disease. But yesterday, when we presented a lot of cases, we were looking at the stage 3 of a disease. So that's meaning a defensive mechanism. So this patient already needs an intervention. So if we waited for a long time just to go and increase the number of ablator, we are just increase the number of defensive mechanism. We are not going to attack those patients. This is why with the national policy, we need to tackle the disease at the earlier stage. This is the data that we published with the health economists looking for the incidence of the disease. So in Saudi Arabia, this is according to the published data, we have around 39 annual incident of a disease per 100,000 patients. But if you look for the most common diseases where it's more the incident, we'll look at the North American and European. And that's because of, didn't you know, the disease of elderly. Still, it's a disease of elderly. We can see it in a young individual, but it still isn't a disease of elderly. But if we translate this information into mortality data, we are not any part of different from the world. We have a 4.3 incident of annual death based on 100,000 patients, and this is based on age and standardized. So what is the problem of atrial fibrillation here in Saudi? We know it's alarming disease. We know that we have a lot of risk factor for atrial fibrillation. Burden of a chronic disease is increasing. Maybe it's beyond what we expect. This is from the health interview survey that's published by the MOH in 2023. Do you think maybe you have 50% of adult individuals, they have a diabetes? 1 to 2. We have a risk of hypertension reach up to, again, 50% with diabetes. Obesity represents 45% if you go to the annual look at for the definition, actual definition of obesity. The aging population. So if we think that we are not aging population now, in 2023 we have 1 million individual that's past the age of 65. But in 2040 we will have around 5.7 million. So atrial fibrillation as a disease is coming and hit us in a bad shape. So we'll have 600-fold increase in the next 20 years. But we are not living in an environment that nobody's thinking what is going on in the future. We know that there is a lot of restructuring in the healthcare, especially in the primary healthcare, and that's basically to go and tackle stage 1 of the disease. And everyone read about the Saudi Vision 2030. One of the main target is improving the mortality, improving the quality, and looking in particular for heart disease, stroke, and diabetes. So what is the advantage for us? So if you look what's going on with the recent healthcare reforms, and then we can think of this into 4 categories. We have progress on prevention, and we have some idea about health system integration, and this is already some plan and work has been done. We have a lot of opportunities to have more data collectively, and I'll explain it in a bit. And I think we are, as an environment, we are ready for innovation and digital technologies. In terms of progress on prevention, as I mentioned, vision of 2030s, one of them is just to reduce the risk of coronary artery disease and heart disease, stroke, and diabetes. What does that mean? That if any one in the healthcare providers, he wants to get some help to reduce certain disease, all the ministries that should serve this vision, because this is one of the national vision. And health system integration, I'll just give you a simple example. Now we have more advancement into public and private sectors to go into value-based care. If you look at the CHI, that means you're not going to get your approval for a certain therapy unless you publish the true information. So by then, they will have a true data of each diseases. And the Saudi Health Council and Saudi National Institute for Health, now everyone is talking about to have a sustainable national registries. We have started ICD registry in the Gulf region 2010, but this is not sustainable. So once come from the provider of the healthcare, and that's to have sustainable healthcare registry, just to know where are we going, and where to interfere, and what is the all ablation therapy, all the advanced technology that we are doing, what is the value of this? What is the cost effectiveness of this therapy? So without registries, you're just spending money without an accountant. So the registries will help in that. Environmentally, I think if you look at the data that we have in Saudi, and I'll show in the last slide why we are ready for all those technologies. Development of the national electronic health records. Now, if you look for all hospitals, either private or governmental, all the patients, they have their own on their app. They can open their blood test, X-rays, medical report. This is part of the transformation in electronic health records. So the current challenges in Saudi, again, we are not any part different from the world. We know that burden of AFib is underestimated. We know that we have a lot of asymptomatic AFib, and that's making the idea how to go and screen those individuals is not easy. Needed guideline, but not only needed guideline. We need guidelines, but we need an implementation for the guidelines. So just writing a paper that only want to read and no implementation is not going to help moving around. We have some fragmentation of our healthcare. This could be good, could be bad, but we need to have some solution how to have standard of care. We have military hospital, we have a National Guard hospital, we have university, you have an MOH, and think people now sitting together to understand which way to move forward to enhance accountability. We know that we have a low awareness in terms of late referral from internal medicine, from family doctor, from general cardiologist, and how to go and have a referral pathway. And I'll just share with you later what we are trying to do as a society to help in those notions. So in getting a roadmap where we tackled, I think for any problem in our life, either you have immediate solution, you have a short term, and you have a long term. If you're looking for the immediate priorities, we need to increase the awareness, and this is why we have this symposium. we have to establish our guidelines. We already start up with the big picture of our Saudi guideline, and we have to spend into have an atrial fibrillation patient registries. For the short term, looking, yes, for the lifestyle medication, you're advising the patient to go and exercise, cutting sugar, get your diabetes check. That will help, but will not help tomorrow. That will take some time to get some advantage of this. And the leverage of development of digital health to get electronic health records, then everyone and all the sectors, they have some information about the disease that we are facing. Developing appropriate guidelines, and this is with the help in terms of screening. Still, as all international societies, we do not determine what is the best way to screen atrial fibrillation. In terms for long-term strategies, then we have to invest more in research to understand what is the nature of the disease and impact in our therapy. And then, as Dr. Abdul Mohsen yesterday mentioned about role of nursing to impact management of atrial fibrillation, which is similar to the heart failure clinic, to have atrial fibrillation clinic. This is, if you have not seen this page before, please go and scan it. This is the thing that we developed, and it has an Arabic web page for the patients, for the society, to understand about the disease. They have a lot of knowledge about the procedure, about atrial fibrillation, what is the symptoms, what to expect, how do you get referred. Even if you have atrial fibrillation that you don't know where to go, there is a button that you should go to ابحث عن أقرب مستشفى, go to the nearest hospital, where we find all the hospitals in Saudi that are able to provide the therapy, whether interventional therapy and non-interventional therapy. With the same web page, they have an English version. This is for the healthcare providers. We're supported with all guidelines, supported with a lot of pictures, a lot of documentation about the procedure and how to explain it to the patient. So please use this as a reference for your patients. And this part of a website, this is not only for Saudi, this is one of the global websites around the world. And I'll just show you the data. We start this campaign in just December 2020, and that's compared to the United States website. They have, in December, they have 8,500 visitors to the website. We have more than 47 visitors to the website. And we have more than 6 million social media react. This is only with the 2 months campaign. We eager everyone to use the website for more education. In the United States, they use the similar website they started 2 years ago, and now here in Saudi, only in 2 months, we're able to reach almost 50% all the react what they're happening in the United States. And this is why when I said that we are ready as an environment to go for the health, digital health, easy access to the patient with all those smartphones that we have. With this, I will thank you.